cocaine 6 times more than a decade ago, meth more than triple, ecstasy more than double. And these are not just statistics. They are, of course, also statistics, but they are human lives lost. 7,500 Europeans a year, not to mention the bloodshed, the violence, corruption also, and social harm that comes with the illegal drugs trade. And this is why today we are taking urgent action to change direction. With today's EU drug strategy and action plan, we sent the drug lords and their organization a very, very clear message. Europe is fighting back. We must fight and we must work hard on all fronts at the same time. It's about prevention on the one hand, it's about treatment, and it's about security, of course, also. We will detect and we will also stop precursors for synthetic drugs. We will find and dismantle the labs where production happens. We will also partner up with our cities, with our communities on prevention and treatment through the European Union Agenda for Cities, which Raffaele Fitto yesterday has also presented. We will also close our maritime ports to traffickers with an even stronger European Ports Alliance and partnerships for port security in Latin America. We will also push for the most modern detection technology to catch drugs sent through the mail and also online, which also happens. We will have new AI tools, X-ray possibilities there. But the fight against drug traffickers must, in my opinion, start long before they actually reach our borders. And that is why we are doubling down on cooperation with partner countries in data sharing on the one hand, but also on joint operations, for example, by building on the success of our special maritime operations. Our EU agencies will also play a very important role there in our new approach. There are key players there. Our EU Drugs Agency will operate a new EU drug alert system to detect precursors and trends also in an early stage. Europol also plays an important role. Europol's new mandate will allow it to enhance cooperation with partner countries and also to, I would say, cooperate better and coordinate operations for drugs in transit. And also Frontex will get state-of-the-art resources like aerial assets, high-resolution satellite imagery. So we're talking about drones there as well. So also Frontex will step up. And finally, drug traffickers use, of course, the latest technologies, and that's why we also have to put a focus on innovation to actually beat them. And that is why we are establishing an innovation campus for testing cutting-edge technologies to disrupt drug trafficking. So altogether, I would say already too many have been lost to death, to addiction, violence also caused by traffickers, and it's definitely time now for us to turn the tides on this topic. Thank you very much.
Thank you very much, Commissioner. I know you have just come from Parliament. That's why we were a bit later, and the Commissioner has to catch a plane soon, so we have a little bit of time for questions. I'll try and take as many as possible. We start there in the middle, please.
Thank you. Alexander Bakker, Dutch newspaper De Telegraaf. I'm from the Netherlands. We know everything about the problems related to the criminals, but it all starts with consuming. And I would like to ask you, what is your message to all those Europeans who are using the drugs?
Well, first of all, we have to give a clear message also to the young people that it's harmful, of course, to use the drugs. And that's why we have a certain toolbox also in the strategy and in the action plan to do better education also at an early stage. I think that is key. We have a toolbox in there with possibilities for member states to use this toolbox and to better educate also at a very early stage. I think that is key to get engaged with the young people at an early stage to prevent them getting into the use of drugs. I think that is key, and that is one very important element of the strategy also.
Thank you, Commissioner. Camille.
Good afternoon, Commissioner. Camille Condessus from AFP. I have a little unrelated question on migration. Yesterday, the Parliament advanced on two of your proposals thanks to an alliance between right and far-right parties. My question basically is, if I understood correctly, when you put forward these proposals, part of the philosophy was for your majority, the von der Leyen majority, to be also present on these topics and basically not leave the migration narratives to the far right. Are you not frustrated today that your proposals are actually advancing thanks to an alliance between right and far right groups? Thanks.
Well, what the Parliament or the committee agreed on yesterday was something which is part of the pact, and the pact was agreed by almost everyone, and we were supposed to deliver as early as possible. But because I think speed is of essence there, and that's why we deliver quite quickly for, first of all, the return regulation, but then also the safe third country concept and the safe country of origin list. We delivered that, and now it's up to the Parliament to decide how they're getting forward. There was a positive delivery yesterday, and now we're getting forward. Now the trilogue start, and it's up to the Parliament and to the Council, and hopefully the Council will take a decision next week in the Council on Monday on the general approach, which would be good because, as I said, speed is important, and we have to speed up and we have to deliver to give the people the feeling that we have control over what is happening. And these three deliverables we presented some weeks ago, and which are now in the Parliament, are part of the whole system to get control back. And it's up to the Parliament which majorities, whoever they are. We presented our proposal, and it's quite close to our proposal, which is good. But now it's Parliament and the Council to decide.
Let's try and group a little bit the questions, and first on the portfolio, and then we can on the drugs topic today, and then we can maybe take some more questions on the portfolio. Florentin.
Thank you. Florentin Collomb from Le Figaro from France. On the drugs strategy, how do you assess the current level of cooperation between member states at the EU level, and what should be improved? And are you sometimes seeing any obstacles in having a pan-European strategy against drug trafficking by national priorities and sovereignty of national forces?
No, we are cooperating very well with the member states. We discussed this topic in the Council, but also on other occasions. So the cooperation with the member states is going really well. I would say we are aligned. Everyone wants to fight drugs trafficking, wants to save lives, actually, and all the member states want to go this way together with us. What we can do is supporting the member states, and that's what we try to do with this strategy and with the action plan, to support the member states, to help them finding solutions with our toolboxes, with stepping up our agencies, as I mentioned, the drugs agency, Europol, Frontex. These are all possibilities to support the member states. So we are very much aligned, and we are trying to help them to get the job done.
Thank you very much, Commissioner. On today's topic, yes, in the back, please.
Thank you, Vibor Vlajnić, Croatian Radio Television. So, question for the Commissioner. Belgium, concretely Brussels, has a big problem with drugs, illegal drugs on the street. So, how will this plan change that problematic situation? Thank you.
Yes, you are right. We see a rise in drug-related also violence in several cities, of course. And its impact to communities also and young people, as we said and mentioned in the beginning. And this is actually exactly why we are stepping up the fight against drugs trafficking. And what are we doing in a very concrete way? We have in our action plan we have 19 very concrete measures actually to support the member states, to support the cities, of course, also there, including strengthened intelligence service, strengthening intelligence sharing, also coordination when it comes to joint investigations, also together with Europol. As I said before, Europol plays an important role. Also, reinforced detection of drugs and chemical precursors. Also tightened controls. So there are a lot of things in the strategy and in the action plan, especially in the action plan where it's a bit more concrete to support cities and member states there. Stronger prevention, of course, also treatment and harm reduction efforts in local communities also. So there are different possibilities and tools in the strategy and the action plan.
Catherine.
Hi, Catherine Fior, Vital Signs. The issue of drugs use it's also a huge burden on our societies and also in the prison system. I believe a lot of the prison population, a lot of the reasons why people are there are linked to crime and drugs-related crime. But some countries have decided to go down a path of taking it primarily as a public health issue rather than a criminal justice issue. And I'm just wondering, in terms of your preventive measures, do you cooperate with the Commissioner for Health on this? Is there an aspect where we could look at the demand rather than the supply? Thank you.
Yes, my answer is yes. We do cooperate. This strategy is a very comprehensive strategy where a lot of different other commissioners were involved. Just to mention a few. Health, you mentioned Vaheli. Yes, he was involved, of course. That is important. But also Tsitsi Kostas when it comes to protecting our ports with our ports strategy. Raffaele Fitto was involved because when it comes to cities, to regions, that is important. Even Commissioner Roswell, because it's also an environmental issue. So a lot of other colleagues were involved in that, which I'm very proud of, actually, and very thankful also. And it's not just a security issue, not just a sort of fighting against criminal issue, which is, of course, also the case, but it's also about health, about environment, about infrastructure also. So, yes, the answer is yes. A lot of colleagues were involved, and this is a sort of whole of Commission approach we took.
I have a question online on today's topic. Mira Banchan.
Hi, can you hear me?
Yes.
Perfect. Thank you for the question. Of what kind, Commissioner, of what kind of partnerships with Latin American and Caribbean countries are we talking about? And are you including United States in this new strategy? Thank you.
Yes, just to give you an example, I was in Colombia 3 weeks ago. Colombia is a very important partner there, of course. I visited the Santa Marta port and saw firsthand how it works, what job they're doing, and it was great to see that there's a lot of cooperation. I also met the law enforcement authorities there who are doing a great job in fighting drugs trafficking. So we try to support them also to set up a sort of similar thing like our Ports Alliance. They're looking into a Latin American Ports Alliance where we support them as well. So give them our experience and our knowledge from our Ports Alliance. So there's a lot of cooperation there. When it comes to the US, we also had talks just at the G7 meeting in Ottawa with the US administration also, and they are very much into cooperating with us. The US and Europe, the European Union, share the same goal when it comes to fighting drug trafficking. Maybe the methods are a bit different, but the goal is, of course, the same, and it's about data sharing. It's about also cooperating all together. So yes, we are working very closely with the US, also with the DEA in Washington. There's a close cooperation there as well.
Angela.
Angela Mauro, HuffPost Italy. Talking about the US, I mean, some days ago you reached an agreement on more tariffs for the countries who don't take their irregular migrants, their citizens emigrated to Europe. And this was criticized as something that replies to the American pressure to have a harder line on migration for Europe. This drug strategy appears to be in the same scheme. What would you reply to this, that also this is in line with what Trump asks and not with what the EU would do in a more autonomous eventual strategy? Thanks.
That's not the case. We are doing our homework as a European Union, and that's what we have to do. When it comes to migration, we have to bring our European house in order. But it's all about migration diplomacy also. Getting engaged with third countries is key, of course, and use the leverage we have as a European Union. Visa, for instance, is one. Trade is another, like you mentioned, which is to change some rules there. So we are doing our job as a European Union. We are doing our homework, and we're just looking at us. But then, of course, the next step is also getting engaged with third countries. But that has nothing to do with the policy of the United States. And also, when it comes to drugs trafficking, we see the situation in Europe. That's what we have to focus on. We have to focus on our member states and our cities and our regions. That's what we're doing also with this drug strategy.
Thank you very much, Commissioner. I don't see any more questions, and it's also time, I think, for you to go to the airport. So thanks, everyone, for participating. Thanks to the Commissioner, and see you all very soon. Goodbye.
Thank you very much. Bye.